Hi friends, here are 10 signs that you should know about to maintain a healthy nervous system. If you have numbness and tingling in your hands or your feet, you may be exposed to a toxin or lack the right equipment for your nerves to heal. Toxins that kill your nerves include alcohol, even wine, cadmium, known to be in chocolate, lead, which can be found in your water, as discovered by Flint, Michigan residents, and mercury found in your seafood. If you are not eating or maybe not absorbing certain B vitamins like vitamin B12, vitamin B1, and niacin, you can also get nerve damage. Simple blood tests for toxins as well as vitamins can detect these problems. Now, sometimes you can see hair loss or bald spots in body parts that have nerve damage. Nerves innervate your skin and blood vessels, so damage to your nerves will cause changes to the health and growth of your hair, which needs blood supply. And as the condition worsens, you will progress to a burning sensation. The nerves are struggling to repair, and now you're being attacked by your own immune cells. And this is your body's SOS signal that it needs help. Toxins such as chemotherapy may cause this condition permanently, whereas nutrient deficiency like vitamin B1, vitamin E, or copper would be correctable if you replace a nutrient in time. These symptoms will eventually involve other body parts. For example, a lack of vitamin B12 will affect how your brain works and make you anemic, and your red blood cells will look abnormally big. Vitamin E deficiency will also affect your brain, muscles, and gut. As your neuropathy becomes more severe, you're going to feel stabbing or shooting pains in those areas. More permanent damage to the skin may occur, and you will notice it will get thinner, smoother, and shiny. Your skin is a powerful immune organ, and these changes put you at risk to skin infections or poor wound healing when you get cuts. You may also notice your fingertips and toes may turn pale or red for no reason, pale or spotty, purple or spotty when you take off your socks. Ultimately, this will all affect your ability to walk, and you will lose balance or become uncoordinated and even suffer muscle weakness. For some of you, I may be describing your journey, and for others, you're just at the beginning stages. It's important, no matter what stage, for you to get together with your medical doctor to figure it out before it's too late. They should review your occupation, your exposure, your diet, your medications, even your supplements, and to see if you are exposing yourself to toxins that are damaging your nerves. They should do a thorough physical exam, including a neurological exam, and you would benefit probably to see a neurologist who can perform special nerve conduction tests as well as muscle conduction tests. Be sure to get your blood and urine tested for toxins and vitamins and minerals for deficiencies or excess. If this is suddenly happening, then you would benefit also to see an infectious disease physician and a rheumatologist to have those experts in infectious disease and autoimmune disease help get to a quick diagnosis and a treatment. Millions of people are unknowingly exposed to toxins and metabolic conditions that damage their nerves on a daily basis, and they end up with similar problems that face CIP patients. This guy can't feel pain, and he's been like this since birth. He has a condition called Congenital Insensitivity to Pain, or CIP. It's very rare, and my hat's off to NAS Daily for highlighting this condition. Patients with CIP can tell temperature changes, but they can't sense extreme harmful temperatures. That's why pain is helpful to you. It prevents burns and frostbite. You can breathe a sigh of relief that you don't have this condition if you feel pain. But lastly, with the epidemic of prediabetes and diabetes, as well as high blood pressure, if you don't have your insulin, sugar, and blood pressure controlled, you will damage your nerves on a daily basis and develop peripheral neuropathy. But if you work on improving your diet, your nutrition, your weight, your sleep, and your exercise, you can reverse this course. And if you're interested in knowing how to best do that, check out the next video.